the CEO with PMD Alliance, and it is always such a joy to see everybody on Zoom. I love this. Some of the faces I recognize and some I don't, and we've got people from all over the country that join this. And I think one of the special parts about this is that we get to have a community without traveling. So if it's hard to travel or, I don't know, 150 degrees out, we can stay inside and still connect with people. So it's very, very inspiring. And this is our second Inspire Me. So this is a new program that we are launching. We were struck by, our team. We're a small but mighty team. So we have about 12 staff members, and we put on about 40 of these kind of programs a year online. And we put on about 35 to 40 live in-person conferences. So we keep ourselves pretty busy, but we're also super fortunate because we get to interact with and, talk with a lot of people across the country. And every single time we leave every single event, whether it's one of these or in person, just profoundly inspired by the people that we meet every day, the resilience that we see, the courage, and then also just the real honesty and presence that people bring. And, that's what really inspired. I'm just going to use that about 500 times. We should put a penny in the jar or something for every time I use that word. But we just thought we need to share this inspiration. I mean, this is what it's all about, is sharing inspiration about people, with everyday stories. And so I'm super excited that we have Maria de Leon with us today. And I'm not going to introduce her a lot because over the course of the next 15, 20 minutes, she's going to introduce herself, and then we're going to open up for questions and discussion. So are you ready, Maria? I've got some questions for you.
I am ready. I'm so excited to be here, Rebecca and Sarah. Thank you so much for having me, and I hope that we have some fun tonight and get to learn from one another.
Absolutely. Well, so I've already said your name, Maria de Leon, but can you tell us where you live and just a little bit about where you live and
Sure. I'm a Texas girl, if you can say. I live in a little town that I like to playfully call Nacogdoches. It's actually Nacogdoches. It's about 3 hours northeast of Houston. So it's a small community, but it's a wonderful, community with lots of trees and lots of, rivers and lakes and things. So fortunately, my husband dragged me here because I'm a city girl, but he grew up in a small town and wanted to go in a small town. And I said, oh God, no, please don't let me go there. But it has been a wonderful community, and there's been a lot of need with a lot of Parkinson's patients here. I've been so surprised how many Parkinson's patients are in this area. And so besides, doing Parkinson's, I have one daughter is about to go to college. So that's been my big thing lately, trying to get her ready for college. So I am going to be an empty nester. So I guess I'll be having a lot more time to spend with you girls.
That's all.
For a year, so.
We welcome that. We welcome your time. Tell us a little bit about Parkinson's, in your family, your experience.
Yeah, well, it's funny because I was telling Rebecca when we talked a little bit that Parkinson's has been part of my life since a young age. That was the reason why I became a physician. I was studying to be a neuroscientist and neurobiology, and one of my professors really impacted me. I assume, I never asked him, that he might have had somebody in the family with Parkinson's, because he talked about Parkinson's quite a bit in classes. So that just got me so interested in the disease and taking care of the people that right then and there I decided I was going to become a doctor and take care of Parkinson's patients. Little did I know that Parkinson's was going to have a more personal impact in my life. My grandmother developed Parkinson's when I was a fellow, and then I developed Parkinson's at a young age. So the funny part is that I've been talking about Parkinson's, my entire life almost, since my family can recall. So when I got diagnosed, it took several years before they realized that I had Parkinson's, because I was constantly talking about Parkinson's, about going to conference, about taking care of patients, about doing this and that with Parkinson's, that finally one day my dad was like, wait, what? You have Parkinson's? So it's one of those things that, it took him a while to realize that I had the disease, that I wasn't talking just about in general taking care of my patients, but, and even when I got diagnosed, because I was so young, and we didn't really see a lot of Parkinson's, or we didn't recognize it in young people, and we didn't recognize a lot of the things like the visual problems and the pain and the fatigue. When I started having those symptoms, and I thought right then and there, I knew in my mind that I had Parkinson's, but of course I had some funny other symptoms that as a specialist, we weren't really sure that that was part of it. But when I started to talk to my husband about it, he was like, you just been hanging out with the Parkinson's community way too long. You just need to get a break and need to, separate yourself, because now you're thinking you have it. And so it was kind of funny in a way to think that. And even when I went to my doctor, who is a good friend of mine, I said, okay, am I crazy, or do I really have this? Is it all in my head, or is it, in my head? And so she said, no, it's really, it's in your head, but not like you think. It's not psychological, but you do have it. So yeah.
It's literally, yeah.
Literally, yeah, dopamine depleted. Mm-hmm.
Yeah. Are you open to sharing how old you were when you were diagnosed?
Yeah,
Because you were young.
I started having symptoms at 36, and it took me
Mm.
a couple of years to get official diagnosis. And I can tell you that I have been through every test in the book short of a brain biopsy. So if anybody wants to know about what a test feels like, I'm pretty much it, because I had so much pain and I had so much visual disturbances, again, myself, even though I had some Parkinson's symptoms, we kept thinking, well, is this MS? Do I have, this or that? And so went to every specialist, have every test done. And so it took a couple of years to finally come down with the diagnosis. That yes, you probably do have Parkinson's. And even then, both my doctor and myself were thinking, well, we're really not sure what this visual problem is and this pain problem is, but let's treat the Parkinson's. And when we did, all of a sudden my visual problems resolved and my pain went away. So that's kind of how I started being more of an advocate and realizing that, and thinking back, thinking that, my patients, some of them complain of visual disturbances and complain of pain and never really knew what, sent them to other specialists, sent them to get second opinions, and we couldn't really find out what was going on. And so looking back, this was part of the syndrome, but never really knew.
Right.
So I thought, if as a specialist, I'm still learning so much, then I thought it was my job to really try to bring that knowledge, to both the patients and other, clinicians, to figure out, how we can improve lives of other people.
Yeah, yeah, absolutely. Well, and then, you're sharing the fact that you had, have had family members. You've really seen different ages of onset and the different experience. And I know, we often talk with people who have a younger onset. It's challenging because your life is in a different place. I mean, if a person has kids, they might still be working. It's a different kind of complexity to navigate. And as you mentioned, of course, nobody has the same symptoms that start the situation either,
Right.
that come up. You talked about pain, and some people don't get that till later, and
Right.
some people never get it. So what do you think about, like, as you think about like a young onset or younger onset, thinking about, at that time, what would have been the most helpful thing to hear, or what did
Well,
you
to
need to
hear,
hear?
it was funny because, again, that's why I do this. And because, the one hope that I had, of course, it was like, yay, I got Parkinson's. I knew what I was talking about. And then like, oh, I have Parkinson's, kind of thing. And having seen, all my patients from, early on to end stage, and seeing what everybody, of course, it's normal to get a little depressed and think, oh my God, I have this. And now, this is going to be my life. But at the same time, having been in this for so long, I realized that, when I started this, my career in neurology, the last drug that had been available for Parkinson's was, like 30 years before. So when throughout my career, there's been all this advances, I thought, there's lots of hope. We can beat this. I've seen lots of changes, advances, the sciences, so I wasn't worried about that. And that kind of gives me hope because, we have advances coming up and just in the 10, 12, well, not God, 13, 14 years almost that I've had it. There's been a lot of changes. But the one thing that didn't really realize, and even when I took care of my grandmother, realized, how much the family needed. But as a young person, I thought, well, I can still handle this. And being, somebody that was always used to doing and making plans and making decisions and wanting to, if I made a plan or made a decision to do something, it was going to get done. And realizing that all of a sudden, your body didn't always cooperate. And especially when you have a toddler, I had a 3-year-old that required mom's attention. And that was quite hard because there were periods where I could not drive. There was a whole year where I couldn't drive because either the disease or because of the medication. And having to rely on other people and having to ask for help and having to, open up because there's still that little stigma. When I first got diagnosed, I didn't want my patients to know because then, well, they're not going to come see me. They're going to think there's something wrong with me mentally, or, is the board's going to get upset that somehow, I am going to put patients in danger or something. So that was that stigma. And, going to therapy, I was like, well, I don't want to see my patient. They're going to say like, well, what are you doing here? There's something. But my husband said, one day he just said, well, own it. If you're going to allow patients, tell patients to do these things, then you have to be able to just do it yourself. And so one day I just went and said, okay, I'm going to own this. And, that's kind of like where the Parkinson's diva kind of started. I'm going to make Parkinson's, look sexy, and I'm going to do this. But still, it was hard to rely on people for help and ask them to help me out. I had to do a lot of falls, and I broke I herniated a couple of ribs, a couple of discs before I said, you know what, I need to start listening to my body and I need to ask for help. There's no, shame in that. And actually, once you can open up and talk about, people welcome that and say, yeah, we're here to help, and you find who your friends are and find who's there for you. And then I can say, if I couldn't drive, it's like, could you please take care of my daughter? Or, can you help me, pick her up from this, I'm not able to drive now. So that kind of in a way was liberating, getting rid of that stigma, that anxiety, people are going to see me, they're going to, what are they going to think of me? The way I tell people, we all have good days and bad days, even when we're so-called normal. I mean, sometimes, I love that commercial from insurance where, they leave the car on and, and things fall on you, I mean, of course, that's happened to me more since I have had Parkinson's. I mean, I remember one day I was going to check the mail, and it's an uphill, or rather a downhill, and I just got off the car and forgot to turn it off and put the park on, and all of a sudden I'm chasing the car down.
Oh no!
So, so of course, I can't run very fast with a Parkinson's, and couldn't run very fast before. So you just have to laugh at yourself and realize that, and then and my family, all these years have it, and they just say, Mom, that's just you. Don't blame it on the Parkinson's. It's kind of like they've gotten to know that I'm just special. So sometimes I think that that's just important to, to laugh and to share it and to realize that there is a support, but you have to kind of start and open up. And, I always say when I speak that if we keep our finger, like this all the time, people are not going to come to us. They're not going to want to hold us or, support us. If we kind of keep our hands open and arms open, then people are more likely to grab our hands and to say, hey, can we help you? What's going on? And I think that that's part of, what I've learned with this journey.
That's powerful. It's like, it's a both and, right? Like you want people to be there for you, and you need to be open to people being there for you.
Right.
And I mean, you're right. And every single person, I don't care who you are, we have moments where we have to ask for help, hard as it may be. And
Yes, yes. And we're just human.
mhm,
And when I had my grandmother, that's kind of when I think I became a better doctor and started realizing the extent of the impact of having a chronic illness or having to live with, with this type of disease. I started noticing the caregiver's looks, the tiredness, the fatigue, the
mm,
frustration, that it's not, sometimes we focus so much on the patients, we neglect the people that support us. And sometimes, everybody's asking, oh, how's your wife doing? Ask my husband, but my poor husband, when I'm down, he has to do everything. So, we need to make sure that we're there for them as well. It's not all about us.
mm. Yeah, it is a, we often refer to it as a team sport, right?
Yes,
I mean,
it is.
everybody's in it. And, you and I were talking before we got going here that it's,
Yeah,
everybody has Parkinson's. They just have a different um, flavor of it.
right,
If you're a
exactly.
care partner, adult
Exactly.
child, or
Yes, yes.
hmm
And it impacts the family. And even like I said, my daughter's grown up with it her whole life because either I was practicing seeing patients or she's had to live with me. And going through all the stages of life, of course, all the ups and downs of, raising a child. But then even when you think that, oh, they've accepted this disease, there's always that all of a sudden they show like, I really hate Parkinson's, or I'm always having to, we're having to, change plans or do this. And so it's always a constant there. And is being able to navigate those ups and downs that, brings the closeness to the family too. And it's
hmm
not always easy. I mean, some
no,
days you just don't want to get out of bed and want to hide under the covers and want to be left alone. And then you have to remember that, well, there's other people that depend on you, count on you, and it's not all about us as much as we want it to be some days, you know. So.
yeah. What is a piece of advice that you give people as they're navigating through this? I mean, I guess I'm even curious, thinking, you shared a little in the beginning, that piece of having to learn that you needed, that you actually need other people. But then
Yes.
thinking, 5, 10 years in, because I think you just said you're about 13 years in.
Yes.
So 5, 10 years in, like what kind of advice would you give to people as they're in that space that you learned or that kept you inspired?
Yes, I mean, as something new happens every time, you have a new hospitalization, or you have worsening symptoms, or have a new fall. It's easy to retrieve and say, I hate this. I can't do this anymore. I want to give up. And I've had those times where all of a sudden you start having a pity party for yourself that, in the middle, like, God, if I'm this bad now, what am I going to be like 5 years down the road or 10 years down the road? And I try to actively mentally say, stop. Okay, I don't even know if I'm going to be alive tomorrow. Things happen just
Mhm.
because, life happens. Just because you
Mhm.
have Parkinson's doesn't mean, but it doesn't mean that, my life is going to be all doom and gloom. And, there's been all this advances. So I try to think all the positive things that have happened in my life and think of all the, the new treatments and think like, okay, well, we'll figure it out when we get there, as opposed to, because like I said, I've been very depressed and medications. And there was one point in about 5, 6 years ago, I was very, very depressed and I was almost suicidal. And the only thing that kept me from not reaching that one is my faith in God, that, that's not the end. God always has the ultimate say in it, but also the people around you. What would my daughter do without me? What, my husband, of course, my husband would take care of himself, but, being a mom. And so that kind of brought me out of it. And realize that when we feel those things, it's our natural tendency to kind of isolate ourselves more and to want to not talk to anybody. So I made sure that I have the close friends, the close people, when I'm not doing well, say, hey, I'm not doing well. And now they know that if they don't see me, they start calling me, hey, where are you? And I'm like, I don't want to go out. Well, we're going to come get you. We're going to pick you up, if you don't feel like driving. So again, that support, that having somebody that's going to, even one person that's going to call on you, check on you, if not daily, weekly, how are you doing? What's going on? Somebody that and also help somebody that's kind of going through what you're going through, because then they can understand. So I have a really close friend that she's chronically ill. She doesn't have Parkinson's, but has had cancer and other things. And so we share a lot of the things. Our children are the same age, so we understand each other. So we call each other a lot. Hey, how's your week going? You know, what's going on? And so it helps to have somebody like that.
Mm-hmm, mm-hmm. Yeah, the friends and the network is so important.
Yeah,
And I think you're right too about the treatments. I mean, we've come a long way with treatment options, and that is definitely something to be grateful for. It may not fix it, but it
yeah,
can sure help every day
yes.
maybe be a little bit easier.
Exactly, exactly. And yes,
Mm-hmm.
I mean, the way I look at it too, that, you know, as we age, and life is a constant change. So we can't, you know, sit there and think, oh, I wish I was still like, you know, when I was 5 years ago or 25. We're never, even if we were so-called normal, we wouldn't feel like we were 25. You know, we evolve, we change, we grow, and things are constant changing. So that's the way I try to look at it, was to see it's just another phase, another part of our life, our journey. You know, some people have diabetes, some people have, you know, seizures, some people have this. Everybody's got something. So it's not, you know, yeah, some things are harder and some things seems like they're immeasurable, and we wish we didn't have it, and I wouldn't want it on anybody else. But again, being a doctor, I think I've seen so many worse things, if you will, you know, patients that were, you know, were worse off or had worse diseases. So I think that, I mean, although I wouldn't go as far as, you know, this would be the disease I want, you know, but and there still could be other things that, you know, so we just have to kind of look at life with a glass half full instead of half empty, which not always easy. I mean, trust me. I mean,
No.
I've had my moments, and sometimes, like I said, you just want to be left alone. And it's good to listen to your body. It's good to sleep. Some days, you know, like this weekend, I think that's why I feel so invigorated. I slept a lot this weekend, but my family knows now that if I, you know, if I rest and I take my time, that I do better, and then they're happier too. So, you know, they allow that more, and so that helps. Listening to your
Yeah.
body when instead of just going and pushing like I used to do, and then end up in the hospital because you overdid, and you know, you
Right.
fell or broke something.
And I think you wrote a book, didn't you write a book?
I've
Um,
written 3 books. I
mhm.
wrote the women's book, the Parkinson's Diva, and then I
Mhm.
wrote one in Spanish, which is
Can
about
you hold it up again? I
oh
saw
yeah,
some people looking at the screen. Yep.
yeah,
Parkinson's
that's the
Diva.
Parkinson's Diva. This is the first women's book in Parkinson's to talk about the issues with women and also young women. There was nothing like this ever or still since. And I think this kind of has helped start the issue about gender differences. And
Mhm.
so I'm really, really proud of that. And then I wrote one in Spanish because there's really not enough literature in Spanish. So the one I wrote in Spanish, and I don't have it in front of me, is called Living with Parkinson's. And it has basically all symptomatic, you know, treatments and how to get diagnosed, and taking into account the cultural aspect, because as Hispanics, we don't like to go to the doctor in general, and we don't like to take medications, and we ask everybody in the world first before we trust our doctor. And so, you know, and we believe in a lot of you know, like little home remedies. And so that's something that, you know, I address some alternative medicine in that. And I think that alternative medicine has a big part, you know, like doing art therapy, physical therapy, and, you know, maybe some teas and things like that. But I think that still we need, unfortunately, we still need the mainstream medications to be able to feel better. And I always look at it as, when you have a car that's starting to go bad, the engine's starting to malfunction, you can kind of patch it a little bit, or you know, by rather fix it by adding medicine and keep it running for years, or you can just run it till it dies. And so without, you know, if we don't treat the disease, I think that's what happens, that you just kind of run it until it runs its course, and it goes faster and it's a lot worse. And when you try to fix it, it's going to be a lot harder and a lot more, not just cumbersome and more, but you may not be able to get back to functioning the way you were. So
Yeah, great point. It's a good analogy when you think of a car, because I think, and it's the same is true for care partners. If you
yeah,
don't, if you can't find the time to do your maintenance on your own car,
yeah,
then that it gets worn down and it just doesn't have the longevity and the, it can't go like it used to go. So
right,
that's a
exactly.
fantastic.
Thank
We
you.
will we can include those the links to the information about those books,
Okay,
including the one
yeah, and
that's in
this is
Spanish.
the one that just came out. It's the Women's Journal that accompanied to the first one, and it's for, well, I think it could be for men and women, but this was designed with women in mind. But it basically has, you know, activities to do like art therapy and meditation, and then it has coloring, and it's got inspirational quotes and things that people can do on their own and in a group, and are things that have helped me through the years, you know, setting boundaries, that self-love principle, to be able to, you have to have self-love first to be able to care for yourself and be empowered to be able to fight the fight, you know, to keep going. And so that's kind of what that book is about, trying to, you know, just provide ways to live with the disease in a positive way.
Yeah, and it strikes me as you're talking about what's in that book, that workbook is, it strikes me that it's really trying to use both the left and right side of our brains so that we're
Yes.
activating that creativity plus the thinking part. And of course, that's always good for the spirit.
Yes, yes, because I think
Yeah.
that it all starts with inside healing first. We can't heal the outside without the inside, and so I think that once we try to have a holistic, I try to have a holistic view. That's how I treated my patients, and that's the way I take care of myself. Is that have to take care of what's inside first, and try to look at the whole person, not just, you know, symptomatic treatment of this or that, but what is really at the root of things, what's going on.
Yeah.
And
Oh, thank you
Sarah,
for sharing that.
I
Go ahead.
just put the link for the book into the chat. It's called Parkinson's Diva. So you can see it, it's on Kindle, it looks like paperback.
Yes, and
Um,
Amazon, Barnes Nobles, yeah, all three books are on Amazon.
Perfect. And I'm thinking now we should open it up in case people want to, ask questions or make comments or have things to share. People that are attending and joining us, you
Yeah,
can,
feel free to ask anything, you
yeah,
know, about marriage, about, you know, children. I mean, I'm pretty much, I think that I've talked about all those topics in the past and in the book, so
yeah. Thank you.
you're welcome.
And you can unmute yourselves or you can type it into the chat if you prefer, but, we'll definitely, it's open for you to share.
and if you need help unmuting yourself, if you have your camera on, just give me a little wave and I will help you unmute yourself too.
Hello.
Hi.
Hi, Randy.
Hi. Can you tell me a little bit about the little visual disturbance?
Yeah, the visual, well, the ones that I was having initially, that had me puzzled, is that I could not see out of my visual field. I kept running into the walls. I could not park my car. I could not get my car in the garage. I was like, and I kept going to the eye doctor and kept saying, you have perfect vision. Your vision is fine. Yet I was running into everything. I was having all these problems. I hit a couple of cars when I was trying to park in my office because I could not see that that part. Even though I thought I was perfectly aligned, when I would get off, I would open the door and I would be on top of the walls or on top of the doors or something else. And it was interesting to me because, like I said, I thought it was acting like I had a tumor or like I had something. And of course, my MRIs were fine. They kept saying my visual fields were fine, but yet obviously I was having trouble. And when I started Acelect, all of a sudden I could see and I could park well. And, it seems like is my eyes, just like our muscles and the rest of our body get stiff, the muscles of the eyes were getting stiff that they would not move completely to the sides to allow for the, to be able to see all of the fields. So they were stiff in that regard. So once they started, got the medication, I'm able to track normal. The other vision problem that I had that started kind of before was that I was starting to have problems with contrast. So at nighttime, when I was going to see, got called in to see patients at the hospital, I was having a hard time detecting distance. I could not tell how far the cars were. And I almost got killed once with a 18-wheeler because I could not tell how far it was with oncoming traffic. And again, they kept telling me your vision is fine. So I didn't understand how I could be almost being run over and not see where things were. But that's part, again, once you started the Parkinson's medicine, there's always that contrast difference with the grays and the blacks and trying to do perception. But what I've realized is that when you're having this problem, is really a lack of dopamine. And when I've upped the dopamine in myself with my doctor's permission, my vision comes back to normal and I don't have any problems with that kind of detection. So that's one problem. The other problem, or two problems, and then the other one that a lot of people have is visual hallucinations, where they may see things. My grandmother had this, and a lot of my patients had this, where you usually see animals or children for the most part. Those are the common things. I had, when I first started my medication right at the beginning, I had a little bit of that. All of a sudden I was seeing, like objects that I knew were not there. And so it didn't bother me because I kind of knew what the disease was doing. And so talked to my doctor, adjusted the medicines, and it's been, 12 years since I had any visual disturbances in that regards of any of them. Sometimes when I need alteration or increase in my dopamine, I do start noticing a little bit of perception, distance at nighttime particularly. And so I know it's time to kind of increase the medicine. But other than that, I've not had that problem. But when I stopped the Acelect about 6 months ago, because my insurance wouldn't cover it, and I got placed on Sedago, all of a sudden I was running into walls again. I couldn't park again my car. I was running into things, and I was like, okay, it's time. So I went back to the Acelect, and so that's been my experience with that.
Thank you for asking that, Randy, and what a great example of just bringing conversations up to your doctor. Because
Yes.
if you weren't, I could see where both of those things, the depth perception, the visual, worrying that if I tell you that I'm running into things that you might take my license away. I mean,
Yeah,
just name it with the fears, right?
That was the reason why I stopped driving for a while, because I was so afraid, especially having a little daughter, in the car. I didn't want to drive with anybody. Certainly didn't want to be driving at night. And then it was funny. And this is something that, I still, as a doctor, is probably not the best policy, but right at about that time, I had to renew my license, and I had to go get my license renewed. And I was like, okay, do I tell him I can't see and get my license revoked and have to go through this? Or, is this something? And so I really, discussed with my doctor, and, we figured that medicine will help us. So, we didn't say that it was my, my vision was impaired. I just didn't drive, until I got better. So I made myself, my doctor said, okay, we're going to hold you, but you're not going to drive. And I needed somebody to drive me. So it took about a year, but I had my license. And when I started being able to see well, my medicine got adjusted, went back to driving. But it's something that you have to, know that if you're in danger, if you're having issues, that you're not going to risk other people or risk yourself to be out there, So,
Yeah. And to bring it to your doctor, because to your
yes,
point, both of those things were things that you were able to address.
right.
And I think, it's so scary and so hard to talk about and so important. So
Well, it
that
is.
was great.
Yeah, and driving is kind of our independence. You take that away, and it's like, oh my God, what am I going to do? Especially when you live in Texas, you can't go anywhere without a car. So,
Right.
so yeah.
It's not downtown New York where you've got
Yeah,
public
you can walk.
transportation
Yeah,
everywhere or
exactly,
something.
exactly. So,
Yeah,
yeah.
great. Any other questions, thoughts, comments from our people across the country that have joined us?
I've got another one.
Yes.
Okay,
Well,
and then Bev has something. After you're done, Randy, I think Bev has something too. Okay, go ahead, Randy.
how do you explain I have a decreased strength in my legs? In other words, if I kneel down, I can't get up. I don't
Yeah.
know.
Yeah. No, that's not, as a doctor, you don't know how many times people call me because they thought they were having a stroke because they felt weak. And what happens is that when your muscles are so stiff, it's going to take about 2-3 times the effort to be able to raise it. So it makes you feel weak, but you're not really weak in a sense, is that you're so rigid and stiff. And that's part of what's hard to, get up from a sitting position, especially if you're low, the chair is low, or going up the stairs. Going down is not so hard, but going up the stairs is pretty hard because you have to get your legs up, right? And and it's kind of like, I tell people, like, grab a sack of potatoes, and it's okay to just lift it, but try to hold it up in the air. That becomes very heavy to try to all of a sudden maintain it. It starts wearing on you. And it's kind of like that. Imagine your muscles, you carrying that sack of potatoes continuously. I mean, you're going to need a lot of energy to overcome that resistance. And that's why people feel weak. Parkinson's doesn't actually cause weakness. If there's an actual weakness, then, got to look at other things, and the doctors would be able to assess that. But it's very common, and I feel that too. When I've been walking a lot and I've been going, all of a sudden, it's like I can't lift my legs anymore. You kind of start shoving, and shuffling and just kind of dragging because it's hard to make that step.
Because it's a lot of energy that you're expending on a regular
Right.
basis.
Right.
Yeah. That's great. And Bev, you had something.
I just
Hey,
wanted to say hi to Dr. Maria.
Hi, my love.
And I have read both of her books, and they're both, highly recommend both of them.
Oh, I love you.
I love you
I
too.
got to see your pretty face.
From across the miles.
Yes, yes, yes.
Every time there's something coming up where we think we're going to finally get to meet in person,
I know something happens. Either I get down,
one or the other of us can't go. So
yeah, I know. But we keep seeing each other like this. So
yeah.
yeah. I'm glad you liked the journal.
Yes,
Yeah.
I just finished it yesterday. It was very enjoyable. Thank you.
Thank you. It's colorful.
Yes.
Yes.
Oh, that's fantastic.
So
That's
yeah,
great.
any other questions? I mean, like I said, anything, don't be afraid or ashamed or embarrassed. I mean, I don't think there's anything really that could embarrass me unless if you don't want to ask it in front of everybody, you can always, give it to them and they can email me or something if you feel like, you don't want everybody knowing, that's fine.
I'm curious, these books are forbidden and you've been a doctor. Well, somebody was going to ask something. I was just curious if there was one piece that you might think about that, is different for a woman with Parkinson's versus a man for Parkinson's.
Well, I think that particularly for young women is the hormones. I didn't realize, that was another thing that I didn't realize, how much hormones play a role in the symptoms, and the medications also interfere with the hormones. So you kind of get into a double-edged sword, because, you know, when you're having a menstrual cycle, your symptoms get worse. You're having your tremors get worse, your stiffness, of course, all the other pains and fatigue and those things, you know, automatically gets worse. But with the Parkinson's and with a lot of medications, the period also becomes more severe, more prolonged, and more painful. And so, and that's a big issue. Even myself, that happened, and I ended up having a hysterectomy a few years ago, because it was just getting to the point that it was just so severe. And of course, having that just made my symptoms, my Parkinson's symptoms, worse. So you kind of get into that issue. And of course, there's the other issue at the other end. So far, I don't think we have discovered that fertility has been an issue, but a lot of the Parkinson's medications are contraindicated in young women that are going to, they're pregnant, or that will be breastfeeding, because they interfere, and we don't know what kind of effect that may have on the fetuses and also on the babies. So that's a big thing that we and several people are trying to get, you know, registry, so that we know how that affects and impacts. The other thing that a lot of women, although men have it too, but a lot of women have migraines, and the migraines, one, the migraine withdrawals increased risk of Parkinson's, and then the Parkinson's medications, for instance, also can worsen the migraines. So then you're getting to that vicious cycle of, you know, having more migraines, having more headaches, and that happened to me too. I've had migraines my entire life. I've had about one migraine a month, no big deal. I was able to take medicine. When I started getting on higher doses of medication, I was having migraines continuously, and had to do Botox, and so I was grateful when new medicines came out and I could switch, and that alleviated a lot of the pain. But, you know, things that I never thought of considering, asking, or wondering about, you know, but that, again, it can happen in both men and women, but women, because they're more likely to have migraines, and they're more likely to be associated with their menstrual cycles, so that kind of impacts that role.
Yeah, wow, complex. And it also, again, goes back to that conversation of having a good conversation with your doctor, right?
Right.
And with your loved ones. So, and getting that medication managed. Yeah.
That's right.
Yeah, that's great. What other questions or thoughts, or I'm looking here in the chat, because sometimes people send into separate things.
I have a question.
Yes, ma'am.
Yeah, this is Judy. I'm in Sun City. We're having a dust storm right now. I experience occasional restless leg syndrome at night. And actually, it happened to me last night. I was awake for like 4 or 5 hours. Could not get to sleep. Do you know anything about how to manage that?
Yes, ma'am. Well, there are a couple of things. One, people with chronic illnesses, and like Parkinson's is one of them, that can cause vitamin deficiencies, particularly B12 and vitamin D. And still, a lot of doctors don't check those routinely. Having a vitamin deficiency, B12 deficiency, can cause restless legs. So that's one issue. That's why women, they're pregnant, have a lot of restless legs, because they get anemic, they be vitamin deficient. So Parkinson's patients, the same thing. The other, restless legs is a symptom of Parkinson's, just like the tremors, just like the sleep disorders, a sleep disorder. And so it needs to be treated. And so the medications that we treat restless leg syndrome are usually, you know, the same medicines you use to control the motor symptoms of Parkinson's. So dopamine agonists, dopaminergic medicines like Cinemis, Levo, you know, Ritari. So if you're having restless legs at night, then you may, need a higher dose of medication during the day, as well as checking your B12. The other thing that happens that may not even be related to the Parkinson's, but sometimes because again, Parkinson's affects all the muscles and can cause a lot of rigidity in the actual muscles like your back. Sometimes you can have pinched nerves, either from herniated disc or just pinched nerves because of the tightness of the muscle can pull the nerves. And when you have those pinched nerves, you can have restless legs. So again, there's something to discuss and talk to your doctors about whether how much rigidity you have, increasing your medications, making sure that you don't have neuropathies either, because like I said, pinched nerves, just because we have Parkinson's doesn't mean that we can't have other things like diabetes. And so, that may be a cause of why you're having this. So it's important to talk to your doctor, but there's treatments for it. One thing, if it's related to your nerves, one thing you can help other than doing B12 replacement is doing B1, vitamin B1 replacement. That helps neuropathies, and it's not going to interfere with any medications, not going to interfere with anything, and you can just buy over the counter.
I do have a B12 deficiency, and
okay, so that may be the reason. Yeah,
just reminded me that I usually take an carbidopa levodopa ER at bedtime, and I forgot to take it yesterday.
see? That's one of the main things. And so doing the B12, and it has to be in either injection or sublingual or nasal spray. If you take it by mouth, it's not going to do anything. The other thing that I wanted to mention that happens that I noticed now that I've been on medicine, one of the things, the Nupra patch, and I don't know who takes Nupra patch, is that dopamine agonist, that is a patch, it's a 24-hour. Sometimes when you suddenly abruptly stop that or it falls off, you may have restless legs. So sometimes when I start having restless legs, I look and see if my patch is still on me. And sometimes with this heat in Texas, it falls off. And that's usually the culprit, that it slid off of me and I've not realized it. And that's my first warning that either I start sweating or I start, having restless legs.
That's interesting because I did use the Nupro patch. I had to stop because it made me so nauseous.
Oh,
And
really?
the first day I was without it, I had restless leg syndrome.
Yes, yes. It doesn't last very long, but the first 24 to 48 hours, when you stop it, it's a feeling like, oh my God, my legs are just,
Exactly. Yeah.
Yeah.
Wow, interesting. Great question, Judy. Thanks. Yeah. Any other questions out there?
I have a question.
Yes, ma'am.
Hi, Dr. De Leon. First of all, I want to thank you for sharing your story.
Thank you.
It's just amazing what you're doing and dealing with Parkinson yourself and still being there available for everybody. Appreciate that.
Thank you very much. Thank you. Yeah. I love people. So I love being a doctor. So can't take that away from me.
That is very evident.
Yeah.
That is wonderful. My question is, there's not been a lot of studies done on women with Parkinson's disease because the majority of the studies that are out there, men are more prevalent to take part in research studies for the medications for Parkinson. What is your thought on that, on why that might be?
Well, I think that, we're still lacking a lot of epidemiological studies. We really don't know across the country who really has Parkinson's. And that's something that they got funding recently, but they haven't initiated the study to try to figure out, who in the country has Parkinson's. Because like I said, where I live, there's a belt of Parkinson's, but they're older Parkinson's. Then you go to California, and it seems like there's a lot of young Parkinson's there. Just, talking to people, I don't know. And that's why we need the studies. But also the studies that we have, we have to realize that for years, all the data we have are older patients, which happen to be male, and they're getting their information from Medicare. Okay, so Medicare are older older patients in general. And so when you look at that, the people that are coming in with Parkinson's are mostly men. So they're looking at that, data, and that's what we need to look at. So that's what we're trying to see, that, women present differently and may have different reactions, and even an older, older women, not old women, but when they have Parkinson's, like what we used to think typical Parkinson's of 55 and older versus young, is that women tended to have a lot more dyskinesias, tend to have more dyskinesias than men. And I think that's partly because I think the doses that we use are based on men's weight and height, and not women's, mechanism. And women tend to be more sensitive. So I'm hoping, now that there's a lot of buzz on gender issues, I think that we're going to see hopefully more research that's going to tell us differences, just like men tend to have more behavioral problems, more psychosis. Women tend to have more depression. Men tend to have more dementia in general. I mean, this is generalized. While women tend to have more strokes. And looking back on my population of patients, and I had a lot of patients, I recall many of them died, and their death was caused from hemorrhagic strokes. And that's because I think that we're not really looking at the way the medications really look and the autonomic function of both men and women. I think we've been so focused on the fact that a lot of people get hypertension, and everybody focuses on the low blood pressure, but nobody focuses on the high blood pressure. And I think that yes, although we tend to have low blood pressure, there are spikes. And I will see that in my patients where we're treating low, and all of a sudden it's like, boom, their blood pressure was 200, 220 over 80. And is that dysfunction of the autonomic that we have with Parkinson's? But we're not measuring that. We're not looking at it. And I think that's what's causing the strokes and hemorrhage, and the fatalities. And I think maybe causing the dementia too, in all honesty. I don't know. But since, lack those changes in blood flow to the brain, I mean, that's one of the risk factors for other types of dementia. I wouldn't see why not. It wouldn't be part of this Parkinson's. But again, we still have a lot of research to do in these areas. My advice to you is that you monitor, especially if there's family history of high blood pressure, family history of strokes, family history of heart disease, that you do discuss it, that you do have a cardiologist, that you do discuss it with primary care doctors, with your neurologist, and know that these Parkinson's medicines, because they're dopamine, they're going to, by nature, that's what dopamine does, is going to affect those things. And so that we need to be vigilant and look at those things and try to be more proactive ourselves. And maybe we'll start to, generate in the interest of the physicians and the clinicians and things to know how to prevent it. The same thing with the dementia and the psychosis. If we're aware of cognitive changes early on, I've always believed in early treatment, like I said with the car. If we can halt it and start treatment at the beginning and find out what the cause is, it's a lot easier to repair and prevent than if we just let it go down the road and then try to give it a medication to improve it.
Absolutely. Thank you for that answer. That was wonderful. I got one more little question, if I may. You talked a little bit about women and menstruation and that impact. Is there, in your mind or in your history, about the estrogen potential increased risk for Parkinson's?
Yeah, that's, and I mentioned that in my book. There's still a lot of controversy. The studies that they've done, they can't agree on the role. They agree that there is an influence. They agree that certainly estrogen replacement plays a role, or lack of, because women that have early hysterectomies, meaning, in their early 20s, 30s, when they have hysterectomies and they remove the ovaries, which is what produces the hormones, they are at higher risk for Parkinson's. So there's obviously a risk. How much of a risk, or how much estrogen needs to be. The same thing with strokes. Women with who go early into menopause, or rather get replacement of estrogen. For instance, women that go on birth control pills and they have high doses, they're more likely to have strokes. So there is obviously a role of estrogen that plays in our bodies, but I couldn't tell you right now, and nobody has any indication like you need to do this or you need to do that,
Right.
other than we know that there are some risk. And that was, when I had my hysterectomy, we left my ovaries. I was still, not menopause, so there was no reason, but I, with all my other symptoms, and my symptoms got some control because, I wasn't having that constant, problem.
Right.
So, yeah.
Okay, thank you for that.
Thank you.
Yeah, thank you for that. And, I'm just profoundly aware. It reminds me of the heart issues,
Yes.
where it took years and years for people to realize that women's symptoms, early symptoms of heart attack, was completely different than
Yes.
most men's symptoms of
Yes.
heart attack.
Yes.
And I mean, so became the number one cause of death, right? Or for
Right.
women.
Right. Yeah, and
Because
some
nobody
people
knew
still think that
what was
women don't
happening.
get heart attacks or heart disease, and it's still,
Yeah.
is the same thing. And the same thing with other risks, for men. We can't forget our men that, it does affect differently. And there have been some studies, and again, there's still, a lot of controversies, but there have been some studies at least to indicate that men with Parkinson's have a higher risk for prostate cancer. So again, things to be vigilant of, especially if there's already family history or other risk factors, to talk and make sure that they're getting the routine exams, so that we're not just saying, well, thinking that there's no influence, medication's not influencing, or the disease itself,
Right. Well, and it's a place for us to, so thinking about inspiring, it's a place for us to, be advocates. And I know we're about running out of time here, but it's a place for us to really be advocates. And as you said, like, speak up, as scary as it can be, but be able to speak up, because it's only through that people actually learn, and that people even understand that there's a need to learn more.
Right, exactly.
Mm-hmm.
And that's why I do this, because I always say, if I, as a specialist, Parkinson's specialist, had so much to learn and still learning a lot, I mean, we need to bring that awareness about what is really going on, who has it, and how to treat it, and how to make people's lives better, and starting treatment early, because I know that a lot of people are still afraid of dopamine, and they want to hold on till the very end because they're afraid of the dyskinesias. And I say to that, one, remember the car, and two, that that was the days when we had no other medicines other than levodopa. That was it. Of course, you're going to get dyskinesias. We have a whole host of medications that you can do 1,000,001 combinations. So there's really no reason not to start medication and start feeling better and start, getting on with life a little bit better than, just being afraid to get to that point, and then being in that point where, you're having so much disability. So, and just because you tried one medication and didn't work, unless you had an allergic severe reaction to it, there's no reason, from experience, both the doctor and as a patient, to try it again, because again, our bodies change. And the combination of drugs is different. So at one point you may be not tolerant because you're on something else that may be interacting it or enhancing it, or you may be having some other medical condition that's interfering with it. And so when that's eliminated, you can go back to it, and then it may prove to be a good drug for you. And then the other thing that these medications, like the dopamine agonists, particularly Mirapex and Requip, that we've been on, people have been on for years and years and years, they stop become ineffective. The body builds tolerance. But the good thing is that if you go off of it for a good 6 months and come back, it works fine again. So just because it kind of stops working or you're not getting the response, if it was a good drug for you, there's no reason to go back to it, you know, because your body, you know, got used to it. Now you eliminated that and you can reintroduce it and it will be like a new drug. So you would have the effect.
Oh, that, and what a wonderful kind of bow on this hour together. That piece of, you know, just keep going back at it and know that, you know, don't be afraid of the medications necessarily. Try it. Doesn't work, you go off it.
Exactly.
But just, it's kind of being able, that is the one place we can take some control. And I should mention, you've mentioned this Parkinson's psychosis, hallucinations, delusions. Next week, let's see, now I have to pull my dates up. Rebecca, is it the 14th, I want to say?
I think it's the 13th, August 13th.
13th. Okay, see, you can't trust me with dates. I just go where my calendar tells me to go because that's all I can do. But okay, so on the 13th, we are having a special spotlight. And it's going to be Dr. Kaplan, and he's a psychiatrist who's going to talk from a psychiatrist point of view on hallucinations, delusions, what's happening in the brain, and it should be really fantastic. You need to register for it. So if you go to our website, you can register for it. It's a spotlight on treatment. Again, it's Dr. Kaplan, the first time that we've had him speak, and we're really excited to have him speak for that.
Awesome.
And yeah, this has been absolutely just fantastic to get to know you and to be with all of you today. And I know that Andrea always ends, and I love how she ends, where she has us all, if you are there and you've hidden your camera, unhide it. But where we can all wave to each other, because at least we can see each other. And what a gift to be able to be with you guys. And we can't wait to do this again. Oh, and hi, puppy.
Oh. It is so wonderful to be here. Oh, I love that. I love that.
So wonderful. Yay, puppy. Everybody learns.
Thank you so much.
Thank you for your time today. Thank you all.
And I hope everybody has a blessed day. Bye.
Wonderful. Thank you. We hope to see you all at the live stream on the 13th.
Okay.
And
awesome.
we will put this out in our e-news. If you don't get our e-news, make sure that you sign up for our e-news. You know, we'll make sure that you know it's there. This will be on our website so that you can rewatch it and share it with friends. But it's great to see all of you. Have a wonderful, wonderful evening.